I'd like to call to order the special meeting of the Round Lake Area School District 116 Board of Education on Monday, November 28th, 2011, the Round Lake High School Theater. May I have a roll call, please?
And after we have heard the two presentations, the first one has to do with facilities, and we will hear from Fanning Howey and Carl Baxmeyer, who is representing Fanning Howey, which is the architectural firm that the district works with. And then we will hear from Brenda Banner. And Brenda is serving as coordinator for School-Based Health Center here in the Round Lake area, and she will sort of share what the work is that has been done to this point. That particular project is in phase 2 of planning, and we'll talk about what the next steps are and why we believe that there is a need for the community.
Just briefly, probably ask, why put the table of contents up there? We'll put it up there just so you know what elements go into a facility master plan. Understand. We looked at the non-academic use of schools. The community makes extensive use of a lot of the facilities, so it was important to look at that aspect of the buildings. The demographics. How many students are you going to have? When I show you the demographic slide, you're going to see those numbers going up. Now, the bad news, good news and bad news. Good news is you are growing. You've grown even during the recession. The other good news is it's not going to continue forever. So, and number 12, the master plan facility summary, is the part that we're just putting together now and we just inserted tonight. You know, it's great to have a plan. The master plan tells you where do you want to be.
As Dr. Collins said, my name is Brenda Banner. My background is I actually was, in my past life, a high school teacher and then also a healthcare professional. For the past 15 years, I have been working with school-based health centers, which essentially marries both of those two worlds, education and facility study. There were two real issues. One issue is there a need? Because again, I've seen school-based health centers being put in communities where there's not a need, and then you build the school-based health center and, oh, it's not utilized. What a surprise. The other is there an interest, is there a will in the community for this? Because there could, in fact, be a need, and if there isn't a will from the key stakeholders, then it's also not going to be utilized. Secondary data underscored by the interview shows that there is a large need here. The number of low-income students continues to rise in the district, and the number of available practitioners is very low here. What we did was we presented the report to the Board of Education. We also presented the report to the board of the Lake County Health Department because they are interested in being the provider of the school-based health center. So let me just take a step back and talk about what a school-based health center actually is. A school-based health center is essentially a physician's office inside the school. Comprehensive services that essentially are provided by a nurse practitioner. Usually there's a social worker, there's a medical assistant. So really it is like going to your doctor's office, but it's inside the school. Students who come to the health center are required to have a signed parental consent form. Okay, that's a critical piece. Students are provided services regardless of the ability to pay. It is, as I said, a doctor's office in a school. It is separate from the school, and it is run not by the school, but it's run by an external entity that works in collaboration with the school. So in the case of Round Lake, the interest is that this would be run, in fact, by the Lake County Health Department. So all of the staff would, in fact, be staff of the Round Lake, of the Health Department. Here's some important assumptions. As we heard earlier, we all know that finances is a huge issue. No school or tax dollars are used to operate the school-based health center. As I said, it would be run by the Lake County Health Department. the Lake County Health Department and the partners that they have would assume all responsibility for running that school-based health center. The only thing that the school would provide is space. And in terms of space, we would not expect the school to pay for the construction. This is something that, as a committee, we are looking to find funds, and there's actually a federal grant that's going to be coming out in the next several months, specifically for building school-based health centers, and so we will be applying for that. So no dollars would come out of the school budget at all to do this. It will not be open. We're not talking about opening this until the earliest, the 2013 school. We're hoping to have it in the high school. Initially, it will just be high school kids that will be seen, and kids who have chronic issues. Then it would grow to the other schools, and then possibly one day to the community. But this is very slow and intentional. You got to make sure that it works where it is before you open it up to a larger population.
Any questions you may have, any comments? I really want to thank our presenters for sharing information on where we are as far as our facilities are concerned and what is scheduled to happen as far as our growth and our concerns regarding the impact on our facilities because of the growth, and then also the idea of the school-based health center. And just that the community members and the initial information we have received indicates that there is a need for this in our community. And so we are glad that you are here this evening and want to take this opportunity to have you ask questions and provide any comments that you have about anything that you have heard this evening. And Heather will assist us in bringing the microphone around, and we simply ask that you identify yourself and your address.
My name is David Gadzicki, 868 Nippersink. I'm hoping that the changes in this health program is not going to cost me any money at all whatsoever. I understand there's like $850,000 of TIF money coming our way, and the school board is also looking to raise their taxes 1.8% or whatever they can legally raise it, to my understanding. With the healthcare center taking room up in the school here, I want you to know my student cannot attend the school of her preference. 3/4 of a mile away, we live from John T. McGee. We're traveling 4 miles to drive our school around Lake Middle School. Why? Because of the has and has-nots. My daughter's either white and she can't go to her school of choice, or she's not Hispanic and she can't go to her school of choice. I'm not sure what Dr. Collins meant by, the has and has-nots. My daughter cannot attend a math class of her choice in Round Lake Middle School, getting a 98%, 90-something% in math. Her favorite subject's math. She comes home every day learning the same thing, saying, "Dad, I need another challenge." So she's brought home worksheets from the accelerated class that we are at home supplementing her education. Your children, check their grades in the Round Lake Middle School. They may be getting an A, but why aren't they driven to a higher standard? Why aren't they given the same opportunity to learn as the other children? Talking about adding on to schools and adding a healthcare center. My daughter, she's in village school, great school, love the school, love the administration. They don't have an art class. The PTO has to raise money so they can have a PTO, so that they can have an art class in the village school. Your dollars are going for a healthcare center. Why? I don't know. For pregnant kids, I don't know. Whatever the reason may be. But challenge some of this stuff. Don't just accept it at face value. I mean, the school system, the healthcare thing, can't get a physical, rent a doctor for a day, give him $40 a student, and have him do as many physicals as he can between these hours. I think we can do this a little bit differently. I don't think we need a healthcare system in here. Why?
Hi, my name is Guy Finley. Almost 6 years ago, this district passed a $21 million bond referendum that said you were going to build an addition to this high school. That has not happened. Now, I know why that happened. It's because of McGee cost overruns. but you haven't explained to the community how that happened, and you want to come back and put in a health center, I don't know where, in a building that's at 145% capacity right now. I really wish that the board would focus on what the musts are and what the needs are, and not what the pie in the sky would be nice if we could have this wants are, because you just had $600,000, $700,000 of debt service come off because the bond for Johnson Controls is gone. You just had $1 million a year you were paying to Net 56. I'm proud to be the one no vote on that. They're finally gone now. You're not paying them $1 million a year anymore. So the district has opportunities to use general debt obligation bonds or other funding devices to come out and get this done, because you told us you were going to build an addition to this building. It hasn't been done. The people in this town raised their taxes after their taxes had already been raised when the tax cap was reset. So you really need to focus on this project for the high school, because it's not a need, it's a must. In fact, I'm kind of surprised no bond attorneys have looked at it yet, because here we are 6 years later, not one shovel has been put in the ground to do anything to this high school. We put a bunch of trailers back there. We have a football field that's better suited for cows than it is for one of the best soccer programs in this whole state. There's a lot of things that need to be done. I hope you focus on those and not the wants, the things that would be nice to have. Thanks.
And the school-based health center, if you recall what Brenda Banner said, this is not coming out of school funding. We are not going to take away from our expansion plans for the high school. We are looking at grant money specifically for school-based health centers. And if and when we get that grant and we add on to the school, we have already gone through many scenarios as to where we can put it and put additional space in the school that can be used for maybe additional administrative offices, so that we can create some additional space in the school. This school-based health center is not going to take anything away from the much needed space that we need in this high school.
And thank you for underscoring that. No, and if you recall the assumptions, if money doesn't come externally for the school-based health center, it's not going to move forward. So it's not like this is going to happen whether or not we get dollars. If we don't get external dollars, it won't happen. In terms of a couple of, the grant money that we're talking about is only for the build-out. That's for getting the build-out and all the equipment. The Lake County, and the reason that we're going to the Lake County Health Department is because they're what's called a federally qualified health center, and they are able to get enhanced reimbursements through Medicaid. So students are seen regardless of the ability to pay, but there will be billing done. And so the health center will be able to recoup dollars through billing. So that's all been included. It's not, we're not asking the federal government to constantly be funding. It's going to be all, it'll be like they're sustaining their own health centers.
Hi, Joe Schumann, 35, 830 North Fairfield. The healthcare center, one of the questions I have, how do students pay for it when they go to do it, or is it free? And then what are the liabilities of the school district? I know they're saying it's separate, but if you have a mental issue with a student, and say the student were to hurt another student, what's the legal ramifications of the school district, because the health center's in the school district?
Well, first, in terms of payment, there's no, like I say, all students will be seen. No one will be turned away if they can't pay. But students who are on Medicaid Medicaid will be billed. And then if you have private insurance, the private insurance will also be billed. And there might be, and again, this depends on, this is part of the whole planning process, there may in fact be a sliding scale, but in most instances a sliding scale is very small. You know, it might be $3 per visit.
Well, if I already have health insurance that I'm paying for, and you guys are going to bill, is it at a special rate that you guys are going to be billing at because there are more low income folks coming in to use it? Do I get paid? Let's say I have to get a flu shot done. My son has to get a flu shot done. If you guys are going to be doing that type of thing, do I have to pay more for the flu shot than a person who's low income paying for a flu shot because they already have insurance, or it's all?
No, it's all right. It's the equivalent, as I say, that you go to your doctor. So if you go to your doctor, you're not paying more to go to your doctor for a flu shot than somebody who's unmedicated either.
And is the health center expecting to do, let's say the whole football team needs to have a physical? Is health center going to be doing the physicals for the whole team and be responsible if there's something happens?
I'm sorry, I didn't hear what you said here.
If the health center's here, and let's say all football kids come in and have their physicals done here at the school, okay, and one of those kids has a heart murmur for whatever reason and passes out and dies in the field, okay, because it wasn't checked properly. Where's the responsibility for that in the school district? And if they're not actual doctors, how are they administering physicals to be able to do that?
Well, they are, depending on what's decided, it'll be a nurse practitioner who is working in collaboration with the physician. And it would be, what you have to understand is, it's as if it is in the school, but it is if the student is going to a physician. So if, God forbid, there is some problem that was overlooked in the physical, that the liability would travel the way that it would travel with the physician. The fact that it's in the school is not liable for that. And believe me, there's a lot, the attorneys are at work in terms of memorandum of understanding and agreement, so it's not something that's gone into lightly.
How is the school district not responsible for an issue if it's in the school district? You have a bill, any attorney, if it's in the school district and the diagnosis is made incorrectly, there's going to be a problem.
Well, in all of my experience, that's never been the case. And again, we have memorandum of understanding where all of this is very much outlined in terms of liability, etc.
Sherry Byrne, 24716 Rollins Road, Round Lake. My questions are about the school-based clinics. Now, when one of our children come in to go to the clinic, are the parents notified that they've gone? Do we have any rights to know what you are doing with our children while they're in the clinic?
Generally speaking, no, parents are not notified when the students come in, though if they come in and they're getting medication, oftentimes they will be called, or if you have your own physician, oftentimes they will be in contact with your physicians. But no, as a rule, parents are not notified. Parents are, before your child is even seen, they have to have a parental consent on file. So you've given your permission for them to be seen. Generally speaking, when they come in, the parent is not called, though parental involvement is totally encouraged. I mean, that is a key cornerstone of the school-based health center, that they work in collaboration with the parent.
But what you're telling me is that if my daughter decides she doesn't want to tell me what's going on, she doesn't have to, and you can't. Is that correct?
In some instances, yes. However, as I say, students are encouraged to talk with their parents. Every effort is made.
But they don't have to.
I think that what I'm hearing Brenda say is that if a parent gives permission for their child to be seen there at the clinic, then the parent is also explained to the parent, and they understand what rights the student has and what rights the parent has. And so any parent who agrees for their child to be seen, they are agreeing to this type of arrangement between the clinic and the student.
I understand that, but say I give permission for my daughter to go in for an earache, okay?
And a couple years from now, say she decides she wants to have an abortion. Is that something that you will deal with without letting me know?
Amen.
Well, school-based health centers do nothing in terms of abortions. And as I said, students are encouraged to talk with their parents. But no, if your student comes in, if your child comes in and does meet with a provider, we can, then the student and your child does not feel comfortable telling you, then we can't tell you. But the reality is that every effort is made to include the parents. No, by state law, right, by state law, all children 12 and over are able to see a physician without parental consent. So they could go to, your child could go, or someone's child could go to the Lake County Health Department or go to the hospital and be seen without your being told as well.
But not at our own high school with our tax dollars right here, though. That's the main problem. Yeah, they can go to the health center, the county and all, but they cannot walk on our tax dollars currently as it is, have an abortion. Does that mean you transport the student to the abortion center?
No, we have nothing to do with
No, I
abortions.
know you have nothing to do, but there's a connection there somewhere.
But she explained that none of our tax dollars are being paid for this clinic.
No, tax dollars are being paid for the health board, not from.
If you live in Lake County, you will be paying for it through your taxes. Is that not correct? You say you're going to them for grants and for money. We all pay Lake County taxes, therefore we are paying for it.
That's something that I can't answer. The grant dollars that are coming are federal grant dollars. In terms of, again, as I say, the money that will be used to sustain the health centers is money that would come to them through Medicaid, which is federal dollars, and also from private insurance. So to my knowledge, no Lake County tax money would be used because, again, they aren't going to do the project, as Doug was saying, unless it's going to be cost neutral for them. So none of your tax dollars will go for that.
Kevin McLean, 1608 Deer Pass Court, Round Lake Beach. I see it as one more step in the socialization of this country, and I don't like that. I don't like the socialization coming into the schools. I don't like that some doctor that I didn't choose for my child is seeing my child if that should happen. I don't like that children could be referred by the school nurse to the healthcare center at her discretion, with or without the parent's permission, and I don't like that the child doesn't, or somebody doesn't have to report to the parents. The parents have full responsibility for those children. They were born in that family, and they should be the ones that have full say-so. And again, I don't like socialization in this country. Funding that's been discussed so much about, it's not coming out of our pockets or out of the school budget or something like that. Again, the socialization is something that creeps in a teeny bit at a time. It's like the camel getting its nose into the tent. Eventually, it'll probably end up coming directly out of school funding, but regardless of whether it does or not, it's coming out of one pocket or the other of each one of us in order to provide this funding, because nobody gives it out for free. The lady down here who's the planner that pushes this stuff into school systems and the board that decides on these things, I'm not sure what the process is, but I would sure like to see a community or a county or a state vote in order to put something like this into the schools.
Yes.
Beyond that, I guess I have nothing else to say.
Before we take our last question, I just want to thank everybody for coming out this evening. Thank you for your questions. I thank you for your comments and for your interest in our facilities, as well as our discussion regarding the school-based health center.